Welcome to The Homegrown Heart, the podcast every Friday morning at 7 a.m. Mountain Standard Time with your host, Dr. Amanda Ryan, DO, MBA, interventional cardiologist, and a recognized expert in that field. This week's topic, the importance of having a strong family and friend support. Please help me welcome our host, Dr. Amanda Ryan.
Good morning. Welcome to the Homegrown Hearts. I'm Dr. Amanda Ryan, your friendly interventional cardiologist here in studio with Danny Fletcher, my amazing producer with Fletcher Media. And we're going to talk today, which is Valentine's. You're going to get this next week on the 21st, but happy Valentine's Day belated. I hope everybody just took a little extra time that day to spread love and joy, which is so important for our overall well-being. A couple things I wanted to really focus on today. This is kind of a unique segment. I wanted to talk about family and friend supports in illness in general. And I'll give some specific examples with heart disease, and then I'm going to take it personal a little bit on something about my own journey to health. The recurrent theme is nobody fights alone. You know, we see a lot of that with cancer battles, and that is so important. As a matter of fact, it's so important, and the navigation of care when you have an illness is so critical and difficult, particularly in our rural areas. Again, if you watch my podcast, if you come to some of my presentations, if you know me in any way, shape, or form, you know I have two real passions in life outside of my family. Number one is improving access to care in rural areas. That has just always, I grew up in a rural area in Southern Illinois. I was in a rural area in Florida, and I'm in a rural area here. That has always been a passion. The more complicated healthcare becomes and the navigation of it, the more of a mission I'm really on to help get access to that 30% of Americans, which equates to 80 million people that live in rural areas in our country. And number two, it's empowering people, particularly young women, but empowering all people to really achieve their goals in life, to set goals and achieve them, and to help as a society and do my part to help make sure those goals are achievable for people. Sometimes that requires thinking outside of the box. Medicare actually recently approved where you can actually get reimbursed to be a care navigator. This was a big deal because sometimes people are completely overwhelmed. If you come to my office and I tell you, okay, your ejection fraction is 20%. First of all, what does that even mean? Okay, this is the first question. You know, what does that mean? That means that your heart's weak. Now, a normal ejection fraction is somewhere 50, 55 range. That means that your heart pumps half of the blood out of it every time that it squeezes. But for some reason, your heart got down to 20%. Now, what are the reasons? Again, that's not the focus of today's segment, but a little, we're always all over the board teaching things during our podcast. Most common reason in America is still blockages. Someone had a heart attack or had significant blockages, and they ended up with part of their heart muscle actually dying and no longer conducting electricity normally or pumping normally. That might be how you got an ejection fraction of 20%. It might also have been from a virus. COVID got a lot of publicity about myocarditis and the COVID vaccine. There's a lot of controversy. The reality is probably the COVID vaccine and COVID, and any other virus, by the way, can actually make your heart inflamed, cause damage, and end up giving you a weak heart. Alcohol, stimulant drugs such as cocaine, methamphetamines, all of these things, untreated sleep apnea, poorly controlled high blood pressure. All of these things can give you a weak heart at some point in your life. So here you are, you have a weak heart. You're going to start on all kinds of different medications. I try to take a stepwise approach with patients. I had a patient a couple weeks ago that I had an interesting interaction with. They had been to the physician that I referred them to in Lubbock about putting in a special device to help their heart squeeze. And they had a little bit of I don't know if arrogant is the right word, but a little bit of well, she shouldn't have even sent you here if you weren't on all these 4 medications at max dose. And the patient came back like, I trust who you send me to, Dr. Ryan, and I trust you. So I'm like a little confused about like, do I really have to take all these medications? Like, what is the situation? Well, of course, we had tried those medications. This is still a functional, driving, working adult. And when you give all the medications to him, his blood pressure gets to about 60 to 70 systolic. So his blood pressure is like 60 to 70 over 20 to 30. Well, guess what? He's too tired, fatigued, and passed out while driving with a blood pressure that low. Heart failure specialists out there who might be listening to my podcast are cringing because, of course, they do want us. It's an interesting phenomenon with heart failure that we give you medications that when you pick them up from the pharmacy, they say for hypertension. And a lot of times the patients are like, Dr. Ryan, my blood pressure is low. It is not high. Like, why do you want me still taking these medications? And I'm like, well, because your heart needs a chance to rest. We really need to lower your blood. It's about afterload reduction, and I'm not going to get into the fancy technical side of it today. It's really to help your heart rest and heal. But again, we have to balance that with the fact that am I pushing your blood pressure so low that you're actually going to pass out? That you're going to feel dizzy and unable to do any activity? So if that's the situation, then we have to kind of back off. So guidelines are great, and we have a lot of guidelines in cardiology. I'm going to speak today actually too with the women of Greater Carlsbad. I'm going to talk about women, their signs and symptoms of heart attacks, how we're not very well represented in any trials. Rural people are not represented, women are not represented, minorities are not represented. We have almost all the guidelines that we've created in America are pretty much from East Coast Caucasian men, and we try to extrapolate that to everyone. And there are times when that probably works, and times when we realize that one drug is probably highly ineffective in a certain group of people. We found at one point that ACE inhibitors, such as lisinopril, are ineffective in African Americans. We only found that by a dedicated trial with African Americans so that we could really study what worked for their heart failure and their blood pressure. So very important if you ever get an opportunity to participate in medical research. There's also a big mistrust of it, and fairly so, by women, by minorities, just by people in general. Like, should we really participate in these trials? And you've got to really look into a trial, who's sponsoring the trial, what are the potential pros and cons of it. I'm not saying jump into every medical research trial that's out there. But if you get an opportunity to participate in one and it really sounds quality, you look it up, you meet the principal investigators, and you feel comfortable with it, I encourage you to get involved. That way we can kind of have guidelines that are more realistic for the diversity that we really have in America. The next thing is guidelines are great, but each individual person is a little bit different. You've got to, as a physician or provider, you've got to kind of look at guideline basis, say every patient with an ejection fraction of 20% should be on this medicine, this medicine, this medicine, this medicine, should do this, 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 and this. And that's an outline. Let's call that a framework that you and I are going to partner in your care and try to get you to improve. But maybe of those recommendations of 10 things, you're going to be able to tolerate 8 of those things. Maybe somebody else 7, maybe somebody else 10. We have to individualize treatment plans in the framework of guideline-based medicine. So it's going to be really important. Okay, and the next thing is, if you walk into my office, I am first telling you for the first time that your ejection fraction on that echocardiogram we checked because your legs were swollen is 20%. If I hand you 7 medications and 3 exercise and diet regimen and 5 more further tests that we're going to get done, you're probably going to feel overwhelmed. And I have the patient, and I love this patient, and I love all my patients, but I love the patient that's going to go research all of that, going to look up on their phone, going to be on their iPad, going to be on their computer. It's going to know almost as much about heart failure by their next visit in 3 weeks as I do after 25 years of studying it. That's amazing. Kudos to you. You can trust some of what Google says, but not everything. But they come in armed with knowledge, with family members who have lots of questions, their questions written out. That is great. And that's going to be about 1/10 of our patients. The other 9 of us are going to fall somewhere in the other extreme is going to be doesn't take any of the medicines, doesn't look it up, doesn't stop any of the activities that might have created this problem for them, doesn't go to the hospital until they're in such shortness of breath and heart failure that they need to be on a machine or that they're not going to survive. And, the person that's doing everything and anything to research and be quote unquote compliant. I try to focus with my patients, and all of my staff do, which shout out to my staff. I get compliments every day about my staff, about their knowledge base, their compassion. We're really focused on depression screening in our office. Shout out to Rayanna, my office staff member, who's really taken mental health as a big focus in our practice. You're a cardiologist, and we're not trying to take over the mental health, but we're trying to get those referrals in place when they're appropriate. And I've been shocked myself by doing a basic depression screen on a lot of our patients. We know to do them post-heart attack and post-open heart. We've seen a lot of depression there, and we definitely focus on them in those patients. But we're starting to just screen all of our patients, and we're realizing that we're uncovering a lot of patients that we're being able to refer for counseling and other mental health resources. And I think that's amazing. When you think a cardiology practice is invested in your mental health too, we have to be. That's a factor, right? Again, if that same person that I'm saying the EF is 20 and here's all the things I need you to do, if they're too depressed to even get out of bed in the morning, they're going to have a hard time being quote unquote compliant with anything that I recommend. That's where this word adherence comes into place. You're not being compliant like I tell you what to do when you do it. You and I together with the other healthcare providers and your friends or family members who are involved in your care are going to come up with the plan, and you're going to adhere to the plan to the best of your ability. Again, this is not patriarchal. I tell you what to do. I'm the omnipotent doctor. You listen, you go home and do everything I say. That's just not how it works. It's not what I want. And that's not where modern healthcare is. This is a partnership. Again, Partners in Heart Health. It's not just a clever nickname for our foundation. Partnering with our patients. Thanks so much to everyone who supported and attended our amazing heart health luncheon last week. We had a panel of patients. I interviewed them. I asked them about their symptoms. I have gotten so much feedback about how impactful that really was to so many members of the audience. We went live on TikTok and Facebook. We had a few hundred to a few thousand viewers at different times, which was great. That means we're reaching more people. And reaching more people at an event where we had panelists that were patients sharing their stories. And one thing that really struck me with the panel, different ages, different sizes, different backgrounds, different, all women with heart disease, all willing to make themselves vulnerable to share their story, because awareness is how we're going to change, we're going to move the needle. Again, heart disease has been the #1 killer of women since 1900. I'm pretty sure most people are not even aware of that, let alone having been aware of it for the last 125 years. We still think of the average heart attack patient as a 65-year-old Caucasian male with gripping 10 out of 10 chest pain. And in my practice, that patient is maybe 1 out of 10 of the heart attack patients that I treat. Meaning different backgrounds, different sexes, different body types, different diets, different comorbidities. Those are the other diseases that that patient has. So again, we've got to extend our reach. We've got to reach our more vulnerable population. Again, I think I've talked about population health on one of my previous podcasts, and how in my MBA program, one of the gentlemen who used to run New York's biggest city-run healthcare system, and he's a population health specialist, and how they call health fairs up there, the carnival comes to town and everybody comes out and gets the free treats, the free little tokens that we give at the health fair. And it's the relatively informed people that have a primary care doctor, that have a cardiologist, that have an endocrinologist for their diabetes. Those are the people that come to your health fairs. They get their blood pressure checked, their cholesterol, they're invested, etc. And again, this is not a geographical disrespect, but in Carlsbad, how do we reach the patients that live in San Jose? How do I make sure that the patients from the areas that are not as high on the socioeconomic status? Just last night, I'm on the steering committee for Carlsbad's development plan, and we've only had 180 people take a survey, and half of them had incomes of $150,000 or more for their household that took the survey. And that's great. But we need the people with a $50,000 household income to take the survey too, right? Steering the future, whether we're talking about healthcare, a whole city where healthcare is a major part of it, whatever we're talking about, we need voices from everybody. When I spoke last week at lunch and I said, okay, we did a big trial that showed in peripheral vascular disease that leg blockages, that our patients in rural areas who had leg blockages were getting more amputations, having more infections, more death, more amputation of the other leg, like terrible statistics. We identified that. In response, we created a huge trial that studied the discrepancies of care in rural areas for peripheral vascular disease, and we didn't enroll one rural principal investigator. No patients, from that area were enrolled in the trial. I'm struggling to see how we're going to connect that to what happens in a rural area if we're not studying anyone in a rural area. I'm like, okay, we've got to somehow connect dots that are relevant. Again, care navigation. So important that the federal government is starting to say, if you don't have a friend or family member who can really help guide you through this process, that we will pay for one to assist you. We will reimburse a physician office that can employ one that can then go out and help people connect their healthcare dots. And it's minor dollars. There's no major money going towards that, but that is a very good program. Because some people really don't have someone to help them navigate their health care. I think this is a study from back in the day that said the day you're told you have cancer, you only hear about a quarter of what the doctor says to you. I would say that with heart failure, and I'm sure there are studies, but I don't know them off the top of my head, it's probably about the same. The day someone tells you your ejection fraction is 20% and we need to lay out all these things for you, I don't know how much of that any one person can really absorb at one visit. This is where we need to roll you into some chronic care program. We need to get you resources. We need to engage your family, your friends that are like family to you, so that we can really help navigate your care to the point where you get the best outcome. When I was 18 years old and an active student athlete working 2 jobs and excited to go to college, where I knew I wanted to be a physician. I wanted to be a cardiologist. You've heard that story. Love you, Grandma and Grandpa. That's what I truly wanted to do. And I slipped and fell at my job at the local Subway store while mopping a floor. For all of you that know me well, that's probably the last floor I've ever mopped for multiple reasons. But okay. So I had a sprained ankle. Crazy, I'd played all these sports, softball, volleyball, all these activities. I had literally never had a significant injury somehow. Now, my mom's an old school nurse. Remember, my sister had the broken arm for 2 weeks before my mom took her in to get treated, if you remember that story. So I never really went to the doctor, and I never had illnesses because, my mom didn't allow us to have illnesses. She was like, rub some dirt on it and you'll probably be fine. So with that mentality, and my mom crazy, stuck in Houma, Louisiana, trying to fix a nursing home in crisis with some somewhat what she called backwoods politics that go into place in Louisiana. Danny knows that. He's kind of shaking his head. He's been a media producer in Louisiana for years, so he kind of understands that scene. So my mom out of town, the nurse mom out of town for 6 to 8 weeks, really working on that project. So they give me crutches, and I have a sprained ankle, and it's black and blue, and I'm sitting on the couch, and 3 or 4 days into it, I am just tears just streaming down my face. I'm a tough person. I was a tough kid, but I really didn't know for sure, by the way, at this point. I had to find out how resilient I really was. I never really had much of injuries. I had a lot of tonsillitis. I had strep throat so many times during high school. My tonsils would touch repeatedly, and everyone kept telling me I needed to get my tonsils out. But they wouldn't do it when they were actively inflamed, right? When you had strep throat, it was when you were better. Well, of course, when I was better, I was too busy working. I was too busy being a teenager, being involved in sports, getting ready to go to college, and I didn't want to deal with it. So I had in my mind, I will get my tonsils out when I graduate, right after my senior year. Because my senior year, I think I missed 53 days of school. And a lot of them were for strep throat. I'm not going to say every single one of them, but most of them were because I had tonsillitis so many times. I had a ton of antibiotics during that year. So all of a sudden I am going to the doctor after having never as a younger child. All right, fast forward. I have this crazy sprained ankle, black, blue, swollen, and I'm just tears streaming down my face. My dad takes me back and forth to the ER in my hometown, Pana, Illinois, which is small, 8,000 people with a small community hospital that I went to about 4 times. Granted, I've never been to an ER in my life prior to that. And I'm like, this is extremely painful. I can't even sit. I mean, I am like in tears. There's like something wrong with me. Like, oh, X-ray, not broken. Sprains hurt worse than breaks. You'll be okay. It'll get better. Okay, here's an air cast to help you. Air cast rubs a blister. I go into my primary care doctor the next day, like, okay, now I have this big blister and my leg is still killing me. He panics, realizing the degree of infection I must have at that point. He gets a scalpel out and turn away if you're not into gross medical stuff, and almost like a big basin, and with a scalpel opens over my medial side of my ankle, and like 1 gallon of pus-filled fluid comes out of my leg. Where I am emergently transferred to St. John's Hospital in Springfield, where my aunt is a neonatal respiratory therapist, 55 miles from home, but where we are used to going for major care in our region of Illinois, where orthopedic doctors come in late at night with long Q-tip type things, sticking them down and touching my bone, because my bone is fully revealed at that point, and so are all my ligaments and tendons and everything else in my leg. I have group A strep, necrotizing fasciitis, osteomyelitis that gets deep in my bone. I end up in the hospital for a month, missing my high school graduation. fused ankle, no hopes of future volleyball or any other kind of sports career, which I was limited to anyway, but I'm just going to say. Missing college, 4 months of IV antibiotics, 21 surgeries total to try to clean out my leg with antibiotics, skin grafts coming off my hips, my entire right rectus abdominal muscle. So try as I might, a 3-pack would be the best I could ever come up with because my entire right rectus abdominal muscles were actually experimentally grafted into my leg microscopically, sewing in the vessels as well, in a procedure that took about 16 hours and 40 people. Shout out to the entire team. Dr. Beth Bergman and St. John's Hospital, all the residents, fellows, and everybody that truly saved my leg. By the way, socialized medicine, when we rah-rah for that, could have cost $1,500 to amputate my leg, cost probably $1.4 million to save it. But at 18 years old, I'm grateful for the $1.4 million save. My family got me through that period in a way that I can truly never repay them. Illness is hard on people. I'm an empathetic physician because of how I was raised and my own personal experiences. I know what it feels like to be the patient. I know what it feels like to be scared. I know what it feels like to be overwhelmed. My sisters, Angie and Nikki, were 10 and 12 years old when I went through that experience. They did everything from help me to the bathroom, to change my commode, to change my dressing, to make my iced tea, to literally watch TV with me, to laugh with me, and to somehow get me through what was truly the hardest year of my life. I was on crutches for 2.5 years. I probably need a follow-up surgery now that I've needed, by the way, for about 20 years. But those of us that have had some chronic illness as well, or some, traumatic events such as that, it's hard to convince yourself to go back and have another procedure done. At some point, you just kind of close it out, like, I'm doing okay. Again, I've proved a lot of my orthopedic physician, Dr. Gordon Allen, fused my ankle and did several surgeries on me, said you better get a desk job, you better be on disability, you're never going to walk normal, you need these rocker bottom shoes, you're not going to have a normal quality of life, all of those things. But he helped me too, because I was on a treadmill with a walking cast. I've ran triathlons. I've done all kinds of things that Dr. Allen said I would never do. I'm an interventional cardiologist, which he also said I better pick a different career. And for a while, I almost did. I loved my therapist. I thought, well, maybe I could do physical therapy. Maybe I could do this. Maybe I could do something else. I was like, I don't think I can be a doctor anymore. I don't think I can do this. Somewhere along the way. And again, a lot of this owed to my parents, my aunts and uncles, my siblings, my cousins, my grandparents looked at me like, Amanda, you can be anything you want to be. You are a small town kid of teen parents who struggled so that you could have every opportunity in the world, and you do not let this stop you. And luckily, I haven't. So, first of all, I guess the little lesson there is that we've all got a story, and sometimes it's important to not just evaluate somebody for what you see exactly in front of you, but to know that we all have stories that help get us to certain points in life. And it's also to kind of really reinforce today's segment, which is we cannot get through complex medical conditions without support. If you're somebody that has a little extra time on your hands and your health is good, There are people out there that need help with medical conditions that you could reach out and do a little volunteer time with, helping get them to appointments, helping them straighten out their medications, making sure that they have home health access if they need it. I'm just saying we've somewhat become a society that is very focused on just ourselves. And one thing about Carlsbad that really speaks to my soul, there are so many civic organizations. There are so many people willing to volunteer. There are so many different worthwhile projects. And people getting appropriate access to care is somewhere that I think we could still shift some of those volunteer hours. So I think that's going to wrap up today's segment. I hope you learned a little bit about me, but mostly I hope you learned about the importance of friends and family helping you navigate your care, that there are options out there. Reach out to us. Again, Partners in Heart Health, Advanced Heart and Vascular Center of New Mexico, Advanced Ambulatory Surgery Center. Like, we are all there. Again, we are here to help you. We have websites, we have phone numbers, which again, the phones can be a little crazy. We have portals, we have all kinds of options. We're here to help you. Hope you have a great week, and we'll continue this Heart Health Month journey next week.